Do you have a favorite story about hypnosis that you could share with us?
Well, a favorite story would be, for example, my introduction to Erickson. So in 1973, I visited Erickson for the first time. I had written a paper about using Erickson's techniques of utilization to work with psychiatric patients, inpatients, schizophrenic patients who are having auditory hallucinations, and demonstrating that you could use hypnotic techniques naturalistically without formal trance to modify auditory hallucinations. And so that was an entree into visiting Erickson. But I was still pretty young and not very experienced with hypnosis. So I came in 1973, in December of 1973, to visit Erickson for the first time. I drove from a meeting. It was an SCH meeting, and actually Herb Spiegel was doing an advanced course at the SCH meeting in Newport Beach. And so I went from the Bay Area, San Francisco, where I was living, and I drove down to the SCH meeting, attended Spiegel's workshop, and then drove across the desert to visit Milton Erickson. I got there about 10 at night, and I was a little disoriented, and I was intimidated by the idea of visiting Erickson for the first time. And I walked into his home. I was going to be his house guest, and I don't even remember how that was arranged. But for those first 3 days that I was there, I was to be his house guest. And so I walked in. It was like 10 o'clock, maybe 10:30 at night. I got there late. I was a little embarrassed about that. And then I knocked on the door, and I had met Erickson's daughter because she was a friend of my cousin's. But that was years before, and only on one occasion. And she introduced me, and there was Erickson wearing purple because he was colorblind, and that was his favorite color. And he was seated to my immediate left. And then what he did to say hello to me, because she said, "This is my father, Dr. Erickson." Erickson did this. And I was standing there cataleptic, because nobody had introduced themselves to me like this before. I didn't have a reference experience for understanding how to deal with that moment. And so I was just stunned. And Roxy took me to the next room and said that her father was a practical joker, but that was no practical joke. That was a complete induction of hypnosis, where Erickson demonstrated the dissociative kind of movement that somebody would have as they go into trance. He fixated my attention, captured my attention, and then subtly suggested, probably he used a little dissociative technique, destabilizing technique, probably he defocused his vision, looking past me, through me, probably paced my breathing, and then looked down in the midline of my body, suggesting go down inside. So all of the elements that I described before that would comprise hypnosis were there. There was a contextual definition that was done indirectly. Indirectly, he indicated this was a time for hypnosis. He indicated the psychological opportunity for dissociation. He indicated a psychological opportunity for changing my attention. And he indicated that I could respond to the subtlety of his technique, to the implied message, because the whole technique was nonverbal. So it was an elegant demonstration. All of the components were there, but it wasn't done in any formalized, ritualized way. And following Erickson for the next 6.5 years, I never saw him do that induction again. So he had seemed to just invent it on the spot, which was perfectly fine, because if you're thinking about your intention, what is it that you're trying to elicit? I'm trying to elicit these components of experiences. If I elicit these component experiences, I can tell a story to do that. I can use a formal technique to do that. I can use a nonverbal technique to do that. I can use whatever is happening at the moment to do that. And then all that I am doing is I'm placing those props. This is like a theater. I'm placing these props on the person's psychological stage. If the person chooses to play with them, these 5 props that I talked about, they're going to define their experience as I'm hypnotized. Once we can get to that mentality, then it opens up new worlds for understanding psychotherapy. You could start to think for example, about a car, a metaphoric car, where the front wheels and the back wheels would represent different aspects of human experience. So the two front wheels would represent thinking and behavior. The back wheels would represent state, meaning sensation and affect. And then the other back wheel would represent physiology. Now, normally in psychotherapy, we give people instruction, psychoeducation, about how to change their behavior and how to change their thinking. And we understand that if you turn the front wheels of the car, the back wheels are going to come along. But when we start learning hypnosis, we learn to directly change people's state. We learn that you can actually talk to the physiology, and the physiology will respond. So by virtue of having studied hypnosis for 35 years, I'm very comfortable and confident in working with people directly to change their emotions and directly to change their state. And it's using a series of these kind of poetic, dramatic techniques that will help to elicit changes in people in their state and also in their physiology, that these state and physiology are not dependent on quote-unquote unconscious forces, but they're experiential. If you want to instruct people and do psychoeducation, you tell them, which is good, to change their thinking and change their behavior. But if you want people to change their state and change their physiology, you need to use experiential techniques. So I don't even really necessarily consider myself a hypnotist, but I consider myself a hypnotically informed psychotherapist, because by virtue of all of those years of studying hypnosis, I think in terms of hypnotic principles, although formal hypnosis is something that perhaps I only do 10% of the time in the psychotherapy that I do.
As I've gone to the different international meetings, it's really struck me that the Erickson Foundation's at a international level has been one of the primary sources of spreading education about hypnosis. Could you just tell me a few minutes worth of the state of the Ericksonian Foundation and its mission and what you're up to with that?
Yeah. Well, we started the Erickson Foundation as a way of honoring Dr. Erickson. It was to coincide with his 78th birthday. And then pretty soon into starting the Erickson Foundation, it wasn't that we wanted to start a school of Ericksonian psychotherapy. The word Ericksonian, probably as psychotherapy, probably the first print of that was in 1978 when we published the brochure for the first International Congress on Ericksonian Approaches to Psychotherapy and Hypnosis. So it wasn't like we were trying to establish a school of Ericksonian thought or a school of Ericksonian therapy, but to take the principles that Dr. Erickson championed and invented and bring them into the broader nexus of psychotherapy. So the first way that we did that was that in 1985 we organized the Evolution of Psychotherapy Conference. And at that conference, that was like Woodstock for psychotherapists. The conference was held in December. It was sold out on Labor Day. 7,200 people came. You couldn't get a ticket to that conference after Labor Day. We used 19 hotels in Phoenix to have that conference. A very complicated bus system. So the people who spoke at that meeting were like, Carl Rogers and Joseph Wolpe and Virginia Satir and Murray Bowen, Carl Whitaker, Jay Haley, Paul Watzlawick, R.D. Lang. So it was an incredible conference, 25 faculty. And I watched in my suite as 78-year-old Joseph Wolpe introduced himself to 83-year-old Carl Rogers and said, "We've never met before." And Rogers and Wolpe agreed they hadn't. So that gives you some idea of where psychotherapy was in 1985. And so what we've tried to do at the Erickson Foundation is to bring together leading figures in psychotherapy and describe some of the underlying commonalities that make psychotherapy work, and adding this experiential aspect into our programs. So the Erickson Foundation organizes the Evolution of Psychotherapy Conference. We organize the only multidisciplinary brief therapy conference in the world. We organize a couples conference on a regular basis. We organize the Erickson Congress. We have a press. We have our intensive training program. There are 135 institutes currently around the world that are loosely affiliated with the Erickson Foundation. I've taught psychotherapy in 40 different countries. So there's a large interest around the world in people learning about Erickson. Now, when I started the Erickson Foundation, I thought the movement would maybe last 10 years. And so here we are 30 years into the movement and still growing very strong internationally. The last Evolution Conference, we have the Evolution Conference every 5 years. The last Evolution Conference had 8,600 people. It was the largest conference ever held solely on the topic of psychotherapy. APA and APA are larger conferences, but they're not solely on the topic of psychotherapy.
Thank you very much for sharing that and for taking some time with me today.